I'm Steve Goldman. I'm the director of the Center for Free Enterprise, and this is the last event of the Menard Family Lecture Series. And so we want to thank the Menard Family Foundation for funding this. If you're here for class credit or for reading group participation, Cardinal Flight Program, we have QR codes on the door when you leave. Scan them, fill out the survey, fill it out all the way so you get credit. Make sure you say what class you're here for. If you're here just for the interest, please also fill out the survey because we'd like to get information about what works and what doesn't work. Today's talk is on the healthcare industry. And the College of Business has a graduate certificate in healthcare, which you can take, and it counts towards an MBA degree. And so if you're really interested in this area, that might be an option for you. And all of the events that the CFE puts on, in some way, it looks at how business makes people's lives better, because that's what businesses do. And the healthcare industry definitely does that. And so I'm excited that we have this panel today. And so we have 4 graduates from the College of Business. And I chose them because I knew 3 of them from my classes, and then I know Randy also. But 3 of them I engaged through the MBA program, and the 4th graduated from UofL before I got here. And so anyhow, we have Randy Bufford, who's got a BS in Accounting and Commerce, founded Trilogy Health Services in 1997. We have Lisa Stevens on the end here. She's Senior Vice President and Chief Operating Officer of the insurance segment of Humana. She's a graduate of our Executive MBA program. Jackie Wilmot co-founded Accelerate Health, nationally recognized healthcare accelerator, and she's a graduate of our Entrepreneurship MBA program. And John Hammond graduated from our Professional MBA program and is Senior Vice President and Chief Human Resource Officer for Norton Healthcare. And so I want to thank them for being here, and I really appreciate you guys coming here and helping out the College of Business. And since this is a panel, I'm going to let each panelist start by describing their path to their current positions of healthcare. So just tell me a little bit about your career, and did you always plan to be in healthcare, and how the heck did you end up here? So,
since I'm the oldest,
yeah. Okay.
Okay, all right.
I'm older.
I think
I'm
I
the
am.
oldest.
Oh, well, anyway, yeah, by accident is how I got into healthcare, and like you said, accounting. When I was in accounting here at UofL, to show you how long ago it was, Big 8 accounting. That's what you wanted to do if you were an accounting graduate. And so I interviewed with 7 out of the 8. I got offers from 6. I will let you know the one that did not offer, Arthur Anderson. Google that and see where they ended up. But I chose Arthur Young and Company. I got into public accounting, had no idea about a healthcare career any way, shape, or form. And the reason I got into healthcare was pretty simple, but the wrong reason, but I got lucky. First and foremost, I was making about $17,000 a year as a young CPA at Arthur Young and Company, and an entrepreneur offered me a position as his controller at a raise of $10,000 per year to $27,000, which will to be all the money in the world. So I made a decision for the wrong reason. And the reason that you should get into healthcare is because you care about people and you care about those things. But I got lucky. And so I joined up with an entrepreneur, and along the way, I found out I fell in love with working with people. And yes, it involved figures. I was on the finance side of the business, but over time, that led to where I bought him out and founded my first company, and ended up taking that one public with another group of investors. And that gave us seed money to, in 1997, start a local company here, Trilogy Health Services, which I stepped down from the CEO role in 2019. It's in great hands today with Leanne Barney, our CEO, and so forth, and I'm now fully out and actually pursuing, I've gone to the other end of the spectrum, a family business where we're going to take care of children. And of course, everything in life you'll hear out of me say is that starts first with taking care of our employees first, and then we take care of our customers. So I was an accidental tourist into healthcare, and it's become 42 years this month that I've been in healthcare.
Yeah. Great.
Who wants to go next?
I never heard that story. It's pretty cool. Go ahead.
I'll go. So mine was kind of accidental. I would say I was lucky. So I've been in the healthcare industry for 34 years. I started my first job just right out of high school, and I was data entering in claims for Travelers Health Insurance. And since then, I've done a variety of different roles. I've been an operator, I've led operations, I've done program management, process improvement, population health, and so I've just I've been with Humana 27 years, and I often get asked, well, why do you stay there? One of the reasons is every couple of years I've just had an opportunity to reinvent myself and do something new and interesting and different. And I consider myself a lifelong learner, and so just leaning into those opportunities. I would also say, and what I share with individuals, is that some of my best moves have been lateral in the organization. I know I see out in the audience you're probably young, ambitious, and ready to just continue to move up. But those lateral moves that I have made in my career have increased my breadth of knowledge across Humana, has been able to enable me to make connections to then elevate me to the next level.
You go next.
I'm happy to go. John Hammond with Norton Healthcare. I owe my time in healthcare almost 26 years now to Louisville, actually. I moved here for a small bank back in the mid-90s. Many of you in the room weren't even a thought. And when that bank was sold, I found myself starting to work for what's now one of our former competitors at Norton. And I spent 10 years there. And I realized real quickly that I liked the idea of, and there's nothing wrong with for-profit or anything, but I really liked the idea of being in a nonprofit environment, really working for what I felt was an honorable cause, really working for people. You know, we have a saying at Norton, there's only two jobs, right? You're either caring for people or you're caring for those who do. And there's something about going to work for more than just a paycheck or more than just a bottom line that continued to drive me. I took a brief stint back into a publicly traded for-profit, although healthcare sort of related company for a while. And then some 13 years ago almost now, found myself back at Norton and couldn't truly be happier to be doing that work. I love what I do. I could probably do it in a lot of different industries and a lot of different places. One of the advantages I have, though, is again, I'm not a direct caregiver, right? But I do help care for those who do.
Great. Jackie?
I guess I'm the only one that purposefully went into healthcare. I'm a perinatal clinical nurse specialist by training, which means I had the privilege of taking care of little adorable patients that I could hold in the palm of my hand. And so I spent about 13 years in the ICU. And then serendipitously, when I moved from Pennsylvania to Kentucky, I really noticed a difference in how care was delivered in labor and delivery and neonatal ICU. So I wanted to do something about that, and I wanted to start a startup company. I always felt like I was an innovator or entrepreneur, but there were state regulations that at that time didn't let me do it. You had to have what's called a CON, and I would have needed one of those to be able to get out and start a company. So Humana was going to be one of my customers, and they asked me to come do what I was going to do as a startup inside their organization. And it was a really great company to work with. I loved it. I spent most of my time in the Innovation Center, and I was able to build stuff and deploy it and just have a lot of fun doing those types of things. My last couple years, and I went to the UofL MBA program about 2 years after I started Humana. And then I went to the United Kingdom and was responsible for building a full suite of clinical innovation programs for the NHS, which was really cool. Humana had a startup there called Startup Europe. And then when I came back, I decided it's time to leave or I will get sucked back in and never go home, because I really enjoy working at that company. So I started working with startup companies, and then I bumped into some people that wanted to start a healthcare accelerator here in Louisville, Kentucky. And a healthcare accelerator is like, you've maybe heard of Y Combinator and others, but it's an organization of people that help innovations get like kind of out of your head and into the market. David Jones was an innovator and started a company. You are. So that's what I do. The company's Accelerate Health, and we've worked with over 1,000 people. A lot of those are UofL students. I used to come here and coach and do a lot of work back at my alma mater. And our portfolio companies that we work with really intensely have raised $1.4+ billion. So it's really rewarding work, and it's a lot of fun.
That's great. There are so many varieties of jobs in the healthcare industry, and these guys are just a little speck of the total amount. And so I think it's important to understand that. But I think I'd like to ask you guys, what do you see as the future of the healthcare industry? What does it look like? What's AI going to take over and not take over? And what are going to be the needs of your employees? What will you need from an employee? That's a whole lot there.
I'm happy to jump in on the employee piece. I can tell you that it will be different. I think what we've seen, coming into this year, and certainly many years ago, was probably different than what we're going to see in the future. With AI, I mean, I think you can probably already see some of the things that happen with AI. Even if you Google something on your phone, and your first answer now, if you notice, is an AI-produced answer. Right? It's not a site or something else. We have a product right now that we're using in some of our clinic spaces, where you can sit with a provider and they can speak to you, and they can differentiate, that software can differentiate between when you're talking about something clinical and when you're just talking about your kid's baseball game. And it only documents the clinical stuff. That's pretty slick stuff. So I think we'll see a lot of changes, mostly in efficiency spaces. From an HR perspective, I think we'll see the ability to comb through resumes, to comb through data sets, and really make faster decisions in a very tight margin business. That's really important, right? So being able to look and say, hey, what's the turnover in this area, and how is it impacting patient sat? How is employee satisfaction maybe impacting patient sat? And take all those data sets, combine them in a very fast way, and be able to make some probably crucial decisions. We are an extremely low margin business, right, compared to other industries. And if you don't find those efficiencies, you will not succeed.
Yeah, I think one of the things related to that I've been thinking about, just having I have been a clinician, is that those automations that are able to happen because of AI. I think all of us who are clinicians are going to have to think about what our roles are and be able to define those roles moving forward, because there's so many things, like AI can diagnose and recommend treatment options, and so that's going to take away work from certain clinicians that do that type of thing. So I think it's important, because we are on a high-speed train and drinking from the fire hose, certainly. But to think in the future, if you do, or if you are in healthcare, to think about how your role that you're looking at now might change related to AI.
And Jackie, just to build on that a little bit, so Humana, we're trying to innovate, leverage AI. A team of individuals that I have are the care managers. And so these are nurses that reach out to members with multiple chronic conditions, or those members that are post-discharge from the hospital. The work that they do is complex, and because of the regulatory requirements, they spend just as much time documenting their call and their interactions with the member as they do actually connecting with the member. So we've been developing programs to create a clinical summary post the call that then the nurse just validates. And what I'm really excited about that is because it creates that efficiency for that manual task that really doesn't provide any value, and it will enable them to interact with more members and improve more health outcomes. So that's the promise that we're kind of leaning into. So I think that's pretty exciting.
Well, I would just echo in, and she used one of the words, because when I think about where we're headed in healthcare, we have a real big challenge in our country around healthcare, and it involves a couple things. First and foremost, we have an aging workforce, and we're all aging. So if you add both of those up, we need more healthcare services at a time when we're aging, so we're going to have less hands-on hours for clinical. So anything we can do to be efficient in healthcare is needed. Okay, and you've heard probably value-based care, and those are all initiatives that are trying to drive better care, better outcomes for using lower resources. A lot of people, when they think value, they think money, but it's resources are valuable. And so that's really the goal of value-based care. Now, what I think is more exciting as I think about AI is efficacy. Okay, right now you get a diagnosis based upon a certain set, but it's not about you typically. It's around what's been learned about that diagnosis.
Yeah.
In the future, AI will be able to take that diagnosis and your individual health stats that we're all keeping, by the way, on our watches, our phones, everywhere, and they will come up with a personalized treatment plan for you that is based upon your DNA, based upon your genealogy, based upon your health history, your weight, your height. Now, sooner or later, you hope a physician gets there, or a practicing nurse, and so forth, but they'll have that right at their fingertips when they first interact with you. And it's going to drive efficacy and, better outcomes. And that's the exciting thing. Yes, it's scary, this, that, and other. I'm going to rely on a computer. No, I don't think that's going to end up being the case. It's just going to provide better data, better analytics, and personalize, your experience with healthcare. And we certainly can use a lot more of that. So it's an exciting time, I think, Steve. But, it'll bring with challenges, just like everything else in healthcare for me has over the last 40 plus years. Change is a constant.
Yeah, I'm real excited. I see lots of things change. For example, in pharmacies, just counting out pills is not a big thing to do. Now, pharmacist has to catch whether or not you have drug interactions, but AI will be able to catch that and tell the doctor right off the bat. So it's going to be some neat stuff, I think. I think the future is going to be tough with the aging population and not a big population following. So the workforce is going to be a lot smaller. But let's talk a little bit about regulation. Of all the industries in the United States, the healthcare industry is the most regulated. And so there's a good reason for that, but there's probably a lot of regulations that help you guys, but there's probably a lot that hinder. And can you talk about some of both sides? And be nice about it?
Well, I think I was struggling when you threw the question out originally. I'm like, helping? I probably talked the flip side of this coin pretty well for you, but.
There are some good things,
Yes,
I think,
yeah.
in regulations. I go back to 1997 or whenever it was that HIPAA first was kind of announced, right? And we started wrangling with that, and obviously the advent of electronic health records was a good thing, right? I mean, it was very expensive for companies like mine to have to move to electronic health records. I think we moved in 2010, right? So some time ago. But those were expensive things, but they're good, and they're good for the public, and they're good for the consumer, and especially the healthcare consumer. I think with some of the regulations we have around how we protect EPHI, we spend a lot of time and a lot of effort and a lot of money making sure that your data and your data and my data and your data is all secure. We do a really good job of that, right? But that takes a lot of effort. That's a regulation, though. And so it's not all bad.
No.
There's plenty of bad, and we probably all know the bad, right?
It's a
I think
double-edged
things
sword,
that are,
right?
things that are around safety and level set. So if we all have to play by the same rules, I think that's probably somewhat helpful. And if they just wouldn't change them so often, I think that's one of the things administratively that is challenging, is when you get used to playing by a set of rules, and things have to change, we understand that, but they're always tinkering, at least, kind of my perspective, which adds a new wrinkle that you have to figure out because you have to remain compliant. And so again, I think things around safety, around, doing the right things, data, those are all good, but sometimes gets in the way.
And if there's any entrepreneurs in the room or innovators, regulatory is a really difficult thing to overcome, but like some of them have said, it's important because it's really important to protect patients, that we're not delivering a drug or a diagnostic that doesn't accurately define what disease you have. But it does come with costs, both opportunity costs and the time it takes to get these, really necessary therapies and medications and diagnostics out to market and medical devices. But the capital cost it requires to be able to get those startup companies through clinical trials and get approved by the FDA is just really, really difficult.
Staggering.
It can kill them. But it is important. There's probably somewhere where it could move a little bit more. They do have like breakthrough devices now that if you have something like when COVID was really rampant, that they had breakthrough devices for vaccines and that kind of stuff. So there is a way to speed up the FDA process and be able to get stuff to market, but it can be tough.
Yeah.
It's tough to navigate. John, you mentioned electronic health records. and there is some regulations around interoperability. So how do we exchange that information from one health system to another? Because that can cause waste. So if you go to your primary care physician and you have a specific test, you get the results. If you go and see a specialist, they may not have access to those results, and they may duplicate a test that may not even be necessary. And so I think there are some good regulations, electronic health records, interoperability, connecting the system to reduce the waste is important.
Yeah, I think that's really important. FDA is probably the biggest thorn that most health people find, and it does good stuff. But I know there's a lot of times that drugs have to go through this process, and it takes such a long time, and people are dying because they can't get the drug, even though it's been shown to be pretty positively.
Well, it's really
Good.
interesting just mapping back to like AI. I've read some stuff about using large artificial intelligent type populations and being able to run like drugs and clinical trials through like people that simulate what's in the claims and all that kind of stuff, but they're not really. So that might really speed up some of those regulatory processes.
If the FDA allows it.
Well, and I think they can
exactly.
use that to more effectively identify the right people to be in those trials. They can speed up that process.
Yeah, that'd be wonderful. I think we're going to see a lot of positive changes. AI is going to be able to find combinations of things we don't know about. So, what do you think about the role of government in healthcare? What is it, and what should it be? And more, less? How should you do less? I mean, where is it that's going to make it easier for you to do the healthcare business that you do and make people better off?
I think some of it's been mentioned, right?
Yeah.
Patient
That kind of thing,
safety,
yeah.
the interoperability, the exchange of the information so we're not duplicating services. What were you going to say?
No, I agree. I would say those exact same things, and it is kind of a double-edged sword. But yeah, I like government to be involved for patient safety reasons and that type of thing. But just my example when we first started talking, the Kentucky government rules kept me from innovating and helping families take care of their babies at home. It ended up, taking me somewhere else, but so there's some good, some that's not so great.
So, because you get different state regulations.
Yes,
Right.
exactly.
Yeah, for example, licensing is a big issue. And
Right.
Very big issue.
Yeah.
Operational rules, insurance company rules are all separate.
We have a few of
by-
those.
Yeah, 50 states all
Yes.
regulate the insurers differently.
That's right.
Yeah, because
And you've got commercial, Medicare Advantage, and then Medicaid. And the exchanges, they all have different rules.
And so if you're in Indiana, you've got certain things you have to cover versus here,
That's right.
vice versa.
Yeah.
And so your premiums are different, and people's like, well, why do I have to pay more here? It's all because of these regulations.
Yes.
It adds to the cost for sure.
Okay. So what about students here in the classroom? They're just starting their careers, and they may be in the healthcare industry, but they might be in another industry. What would you recommend to them? What should they consider? What would be important to them to
I
do
just
well in their
think
careers?
don't have tunnel vision and keep your eyes open for opportunities. You had like a really great story.
Yeah.
When I worked in the Innovation Center at Humana, our Chief Innovation Officer did not hire people that had insurance experience. He didn't hire people who were in healthcare. He hired like really interesting folks from different industries. And one of them that sticks out in my mind is he hired this guy that does predictive modeling for enemy submarines in the ocean. And so he hired this guy to create the predictive model for Humana to find the enemy submarine in the claims. And then that was pulled together, and that's how Personal Nurse found the nurses or found the patients that we were going to talk with. So it's just, you don't have to be trained in healthcare to get in there. There's lots of obvious ways to get involved. It's a lot of fun because if you like complexity and you like teasing stuff apart and figuring things out, that's an industry to be in, don't you think?
Absolutely. They used to call me solution-oriented. because the rules change constantly, the markets are changing constantly, the payers, the employee, the workforce, you name it, it all changes. So I think, it's kind of challenging, but that's also, I think you said you reinvented yourself every couple of years, or somebody said that in a new job and a new role. And if you think about, our Trilogy story, I mean, we reinvented that company constantly from when we first started, and what we were delivering and the type of clients we were taking care of, in terms of post-acute clients, senior housing clients. I didn't envision we'd be launching businesses in pharmacy, lab services, rehabilitative services, kind of to coordinate better the care, the interoperability you mentioned, the IT. I didn't even realize I'd learn how to build things, but to get the right, kind of environment for our, customers to be living in, I had to learn how to build things and be, that was kind of like a change for me. So it was very exciting. But more importantly, I think the takeaway you said for somebody out here, may not even be in healthcare, do something you love in life if you're going to work. Your employer will love it, you'll love it, your family will love it. Don't take a job just for a paycheck, or I understand we all have to pay bills, but keep looking. If you're in that role and you're not happy, keep looking and try to find that passion, because life's too short not to be happy and in what you do and so forth. So I think, and I didn't know that when I was young and your age. I mean, I wanted to retire by the age of 40. I'm 65 and I'm never retiring, and actually it says on my email, not retired, because people think I am. And I love working, but I love working with people, and that's where I found my passion. So that would be my advice, Steve.
I'd echo a little bit what Randy said. I think find your why, right? There's so many different things you can do in healthcare. You can be an accountant, you could be a doctor, you could be a nurse, you could be an IT person, you could be an HR person. There are so many different places in healthcare that you can find your place. Find your why, and if it fits in healthcare, go into healthcare, right? But your why should also be driven by, and I want to speak for my esteemed panel guests, but your why should also be driven by, if you're going into healthcare, do you want to do care for other people? It's what it's really about. Every one of us in some way, shape, or form up here has played a role in making sure people are cared for. That's what this business is. This business isn't about building buildings, although we do build buildings. If you don't know, Norton just built a great building in the west end of town. So it's not like we don't do that, but that was to care for people. That's what healthcare is about. And I think if that's not your jam, it shouldn't be where you go.
Yeah.
Healthcare needs people that want to care for people. That should be part of your why.
A mentor once told me purpose over paychecks. And to build on a little bit what you said, Randall, is things are just constantly changing. And so another person told me, you've got to figure out how you stay relevant to the work that you do and the company that you work for. And so that requires not only operating in the here and now, but you also have to be looking forward and thinking about what the future holds and how you prepare yourself for that. So I just add that.
At least you don't care if I steal that, do you? Purpose over paycheck.
Purpose over paycheck. Yep.
So I've had students say, oh, well, I want to work for a charity because I want to help people. And they think if you work for a for-profit, I know yours is nonprofit, but they think if you work for a for-profit company that you don't care about people.
Oh, no, that's not true.
Not
please
true.
disabuse them of that notion.
Well, Sister Mary Martin McAtee told me one time, she was the CEO of St. Joseph's Hospital in Kokomo, Indiana, and I made the mistake as a young person talking to her about we were going to participate in a joint venture with them, which we did, and it's been very successful for us. And I said, well, there might be a misalignment of values here, sister, occasionally, because you're not-for-profit and we're for-profit at Trilogy. And she looked over the desk at me and she said, young man, which I obviously loved her when she said that, she goes, we make money or we go out of business. And so not-for-profits are very similar. They have different mission, but they have to have at least enough revenues to cover the expenditures of the organization. So they have to run things in a business-like way. It's just different. And their mission and the outcome of the proceeds may not be going to shareholders. They're going actually typically back into community and reinvestment. But again, every healthcare business to be sustainable, whether you have a tax ID number that's different, has the same kind of goal. They have to be sustainable. And that's important. So that's why you do see the innovation out of the not-for-profit sector just as much as you see it out of the for-profit sector, because that's what you have to do to survive.
No money, no mission.
No money, no mission.
Our teammates at Humana care deeply for the members that we serve. Today, I participated in a town hall, and we had one of our Medicaid care managers tell a story. Her name was Sissy. This was an elderly gentleman and was homeless. And so she figured out how to connect with him. She met him on a bus stop. And there they filled out paperwork where she was able to get them access to food, a primary care physician, reached out to community organizations, nonprofit organizations, and was able to find them housing. And so it's not just about the company, but it's about the teammates that you work with, those associates there, and them caring about the individuals that they serve.
Thank you. I get so tired of politicians talking about, and they particularly do this with insurers, putting profits over people. And they don't realize all the good that insurers and all the rest of the healthcare industry does. Right. And students think that Humana's profit margin is 25%. Apple's profit margin is 25%. You guys, with all the apples, you gave them a bunch of your money.
Well,
profit margin at Humana?
To put that in context, so Humana's been on the news this year, right? We've had a challenging year. Our goal over the next few years is to get back to a 3% profit margin. So put that in perspective.
And hospitals aren't.
No,
it's much
we're not
better.
dissimilar.
Yeah,
Yeah.
exactly.
Yeah, and so it always strikes me so odd that somebody would even make that statement.
Yeah.
Yeah.
It's, when I went to work at Humana, I kind of, thought that because I was just shocked how everybody that I encountered in that organization, it didn't matter. Well, maybe there's a few, but for the most part,
There's probably a few.
People really cared about their members and patients and their well-being. It's just, and I also was just shocked at how many clinicians work there too. It's just, it's.
We do. We have a lot of nurses, nurse practitioners, and MDs.
Pharmacists, MDs.
Pharmacists, that's right.
So I think business analytics has become really important. And how have you guys incorporated that?
We use it constantly.
Yeah.
Jackie talked about predictive analytics to find, not in warfare, but we use a lot of predictive analytics to understand which of our members need the most help and what type of help they need. And then we're able to engage with them. We're also trying to figure out, healthcare is expensive. How do we make healthcare more affordable? Experts estimate that 25 to 30% of healthcare waste is wasteful. There's no value associated with that. And so how do we use data and analytics to understand how we help our members receive the right care at the right time, in the right setting, so we make the overall system more affordable?
We have tons of data. We're a large system, and we have data. We have clinical data, we have business data, and we have people that spend all day long looking at the data. And the data helps drive decisions, and we refine that more and more as we go along. But I think without that amount of data, we wouldn't be able to deliver the good patient care that we deliver. Yeah. We wouldn't know what's the right site, what's the right time, what's the right, if we don't have those data sources, we're dead in the water.
And then from an entrepreneurial perspective, if you don't have the right information to make decisions, even in small companies and dashboards, you go out of business. I've watched it. I've been a part of startups and coaching and the idea. Yeah, you can make a few decisions on gut reactions and kind of the anecdotal information, but typically those are going to be flawed. And so you have to have access to good financial, operational, clinical, whatever it is, to make decisions, and you have to let that guide and be a part of your decision-making process. And yeah, there is some instinctual behavior around analyzing data that you can never get away from. I think that's a little bit of the challenge of AI, is there's a little bit of an experiential factor and a trend factor, but again, you have to have it. And if you don't make it, you end up making uninformed decisions, so it's important.
I think entrepreneurs are really important. For example, there's entrepreneurs who have come up with this idea of using AI to transcribe for the doctors instead of having all these transcribers.
That's right.
And so they've replaced 300 people with a computer. And so what are some things that are missing that some really cool entrepreneurs could say, oh, maybe we could do this? And just pie in the sky, I know I didn't put this down as a question, but is there anything like, oh man, somebody could do this, it'd be really cool?
Well, Jackie and I got a ton of ideas, but if we tell this group, they're going to act on them, and then we're not going to be able to do it. No, I just think the sky's the limit in terms of analyzing right now with the ability, the computing power that is at the tips of everybody, and access today to kind of solve problems. Okay, and find those niches where you can do it. And so I don't know if I have the idea in hand. I do know that a more to me, the future of healthcare involves a lot of stuff we talked about, but it also, to me, involves us taking control of our personal healthcare and being more self-directed, okay, and coordinating that. And the advice I always give to everybody who has someone that enters the healthcare system for something's wrong is get somebody to help coordinate that, because as we talked about, Lisa, it's not well coordinated today because we aren't interoperable. Okay, we can't see that. I've had a situation where I've been in a hospital, go to a doctor's office in the hospital, they couldn't get the test the hospital ran, okay, until I redid everything, and then they submitted, but it wasn't live. Okay, and so that needs to be fixed. So there's all these kind of opportunities if you look at them, and I think being able to use innovative ideas and AI, if you will, or just machine learning, whatever. You gave a great example on the transcription. I mean, there used to be people literally listening to tapes, just typing. And I mean, think about the labor that's involved in transcription, and that's the tip of the iceberg, I think, of the savings. So.
I would say any innovation around keeping people healthy.
Yeah.
Right. We were talking a little bit earlier about some of the things that we've been doing at Norton and trying to change that life expectancy disparity because of your zip code. Right. If you focus on keeping people healthy, that doesn't happen anymore. Right. The object of an organization like mine shouldn't be to care for those who are sick. Right. That's what we're going to do, but to keep people from becoming sick. And I think anything you can do in that space to try to get people earlier warnings when they are maybe getting ready to have some sort of issue, or to keep them from ever even having the issue, is where the real innovation is.
And to build on that, I think it's around engagement from the patient.
Yes.
And them realizing I need to take action and have the tools to take action on it.
Just be present, use your eyes and your ears and observe. I think if any of you went to a pharmacy today, you would see it's ripe for innovation with a lot of different things, from staffing to how they pull up their meds and all that stuff. I have an idea every time I go to the pharmacy. I want to go home and work on it. So you got to find something that you're passionate about, and you can find that through your family. You can find it going into retail centers, when you go to the hospital, when you interact with your insurance company. They're all over the place. Just grab one and start thinking about it and finding out.
I love that, because I think about the same things. You want to go to Walgreens, they're understaffed, they can't serve you, so there's a business opportunity there. And I see it. If anybody wants to take it, we're just going to drive by a place, put a code in, and the door's going to pop open and you pick out your meds. Okay, that technology is already there, it just needs somebody to do it. Okay, I mean, literally, you would just have a kiosk. Now, it had to be one that people couldn't rob and all those other kind of things. But again, that interaction with that person at Walgreens, whether it's through the drive-through, is very inefficient. Okay, and if you know what you need and a prescription can be done, why can't it be filled and put in there? And then it's just, you just go pick it up as you drive by. I mean, obviously, you can get it now sent same-day service, right? People are doing that to your homes and trying to meet that, thing, but that doesn't work for everybody. So.
Yeah, the mail thing has its issues. When you need something immediately, sometimes it doesn't show up. But regulations are probably going to make it difficult also. We're always in the way. And these are regulations that be in the way of something that actually is going to help people.
Yes.
And I fear that. There was a glut of pharmacists. We go on these MBA trips, and I remember being on this trip with a pharmacist, and she said, oh, there's so many, we need to cut back. And now there's not enough. And it's only been like 10 years since I went on this trip.
Do you know why they're not enough?
Because
the employers drove them out.
Well, and then farm techs go and they get trained and they don't stay.
Yep, and I mean, there were a lot of, this is a business I know very well, Steve, but I mean, to kind of cut you off on that, but, you know, literally they made the work conditions where it was so miserable to work in the Walgreens, the CVS, and they went to school to become healthcare people, and all they did end up doing was filling prescriptions. And, you know, it used to be when we grew up, they practiced. They leaned over the counter and talked to you about the meds you were going to take. They had time to look at the interactions, but the employers wanted more productivity. They wanted to bring in the minute clinics, which required, because they're healthcare people and they now had to manage people in the minute clinics. Well, that was a failed business model. And so that's why you're seeing the CVS's, the Rite Aids, the Walgreens, you know, they have failed because they lost sight of their mission of taking care of their employees first. And if they had probably went out and talked to the pharmacists and said, hey, this is what we're going to do to you, they'd have said, no, that's not going to work. And then you have to listen. That's what you do. And I think that we have pharmacists. They're out there. They're just not wanting to work. And they've gone into taken that advanced degree and gone into other healthcare things. And it was really around work environment.
And that medicine reconciliation is absolutely critical. When a member is discharged from the hospital, if they don't have that reconciliation, they have a higher percentage to readmit for that same condition. So that shortage of, you know, pharmacists is critical.
So I had an opportunity. There is one company in this country that controls 90% of the claims data on pharmacy. And I interacted with them with the idea that if we could obtain that claims data and use it for medication administration on admission, upon this, that, and other, we would save so much time and be so much safer. Because typically, and especially with seniors, not everybody has the whole picture of all the meds they're on and how they're interacting. And so we were going to do this, and you know what? That group is sponsored by pharmacy providers, PBMs, and they wouldn't allow us access, thought we were a threat to what they were doing. And this was all about patient safety and their revenue coming into conflict. And that's one of the things that's the one that gets the, you know, stories and so forth going, because that's an idea where profit or their, you know, relationship or partnership has stood in the way of a good thing from happening. But Medicaid reconciliation is very, very important.
Yeah, the medicine.
Yep, medication.
All right, well, I've got a couple, not big questions, but is Ozempic really a miracle drug?
It's an
It
expensive
seems like it could do everything. Ozempic.
It's very
Seems
expensive
like it
drug.
could do everything. They find something new every week.
Well, I think the
don't know.
message there is if you're healthier and you carry less weight, it impacts everything positively. That's a pretty simple thing to understand. But yeah, they're studying all that. And the reason they're doing that only is they want to get paid for more disease diagnoses and make it more available. And that's, you know, got great intentions around that, because you're exactly right. I mean, if you're hypertensive, you weigh less, you're going to not be hypertensive, you're going to get off a med and be healthier. So I think, yeah, in terms of a lot of that way, it does seem that, you know, the GL1s, if you will.
Yeah, I think there's going to be more drugs coming out like that. I'm excited.
Yes.
Doing other things. So this is a really strange question, and it's a complaint I have. And so I looked it up on the internet, and I'm not the only one with this complaint. And it happens.
Now we're curious.
It happens in your hospitals, but the rest of you guys, it's not as relevant. But why do they have TVs in all these waiting rooms blaring when everybody's just sitting like this and being hit by all that noise?
The hospital guy, he can do
Is that a real question?
It's
Yeah, it is a real
worse. It's
question.
worse in the dentist
And I
office.
mean, it's really loud, and nobody's watching. It's just kind of, so you should take them out and see if people act any differently. You do that, you'll be the best hospital, even better than you already are.
I'll say we are the best hospital.
Well, I know, but you'd be even better.
Okay, moving on.
All right.
We digress.
Hospitals out of the
there.
waiting room.
It's gonna make that
TVs.
change.
Steve's personal,
Yeah.
personal,
That's the only reason I had this panel.
so you can air that grievance.
All right, so I think I'm out of questions here, but if you guys have any questions for each other
Well,
first?
you were going to
Yeah,
talk about
you were
what-
going to ask us about the
Jobs.
best question you haven't asked yet.
Oh,
yeah,
you mean about,
What do we hire for? What do we look
Yeah.
for?
oh, I didn't do that one, yeah.
You didn't. I thought that was one of your best
Yes,
ones,
me
personally.
too.
Oh, because we changed it. Yeah, so when you're looking to hire a new employee fresh out of college, what is it that you look for? What are the important attributes of these students.
You
would
changed
look
the question. It didn't say fresh out of college, but we can do that.
Yes,
Well,
we can do that.
for. Because you're going to be hiring these guys. If you're hiring these guys.
I know.
No, I mean, to me, it goes consistent. I think
Yeah.
all four panelists might say the same thing. We hire for character over competency all day long.
Yep.
And what I want to see out of a candidate is that their values align with the values of the organization that they're working with. And we can teach, we can train, we can educate. I mean, the fact that you've gone through this fine institution here, that tells us that, okay? But, you know, it's hard sometimes to train on values and character. And those are the difference makers in healthcare that we need, and that's what we're seeking. And at our organization, I'll let them all things, we felt so much about it, we had an acronym, designated all of our work areas as an NAZ. The N is no, the last is zone, and the other one resembles a donkey in the middle. So we were no asshole zone. We don't like drama.
We have that too. I have
Yeah.
that same rule.
Some people call it no drama,
Yeah.
what have you. Life's too short for that. And again, so we looked hard at character and would you fit in with us? And if you go back, and this is not a healthcare thing, if you go back to the early days, this is a great business story for you guys to read Zappos. They had a different view of the world. They just wanted to have people that they could have fun with. In fact, Tony High said he wanted to have somebody go out and get drunk with. Well, you know, that doesn't pass the HR team. They don't like that. But, you know, the same message. Well, it's just people you could get along with. I mean, we don't have to be clones. We don't have to be similar, but we have to have similar values. And I think that's the most important thing. Drive, energy, and, you know, so if you're researching a job, research who you're interviewing with. See if that fits for you before you go in there because you want to be authentic.
Yeah,
So.
and you need to interview them
Yeah.
as well. One thing that just struck me as you were talking, if somebody says, an employer says, we can't hire you because we don't do this, or you have to have this experience. I wanted so bad to work at Children's Hospital, and they said, you cannot work here. We don't hire new grad nurses into our neonatal ICU, which is an 80-bed, they ship all the sick babies here. And I talked my way into that job, and it's just one of the most interesting jobs I ever had. Don't let anybody tell you no if you have a passion for doing that, and provide the rationale about why you would be good at that. I think the other two things I look for is anticipate your new person that you're working with needs. Like, I am a mother, I've done mothering for 30-some years. I don't want to mother people that work for me. I want them to come prepared. I want them to think ahead. How would they make the team work better? How would they make my job easier? And then be accountable. This is one of my biggest nits. If you say you're going to do something and get it to a person on Friday, if you're not going to get that, it's okay. Just let that person know. So, you know, anticipate, be accountable, all the stuff that you said, and yeah, and be present, and don't be a whatever.
And then,
Yes. At Humana, our values
They'll bleep that
are.
out, I hope.
Oh, I was just going to, at Humana, our values are caring, curious, and committed. So I loved, Randall, what you said about we hire for character. Do you care about the work that you're actually going to do? Are you curious? Are you somebody who is solution-oriented, right, able to solve a problem, and are you committed? Are you hardworking? Do you show up, and do you show up on time? Somebody told me many years ago, half of doing a great job is just showing up. And it's crazy how many people just aren't committed to the work. So caring, curious, committed.
So I would say, first and foremost, somebody said this, do the work on who you want to work for, right? So look and see what they're about. I can tell you that we look primarily for people who are going to mesh and subscribe to our mission, vision, values. And I know everybody says that, but it really is important to know what the company's about. You know, some of our values, respect for all, right? We care for respect for everyone. We care for people regardless of your background, regardless of your gender. We don't, and those are core principles that we've put in our mission, vision, and values. Look at those things from an employer before you sign on. You don't want to sign on somewhere where your goals don't align. And I think it's particularly helpful, and you've heard me say this a couple times up here tonight. It's particularly important in this field. Right? This field is about caring for people. If you're mismatched to that mission, it's not for you. It really isn't. And I think you have to go and look at ours. Look, if you're going to work in this space and you want to work for a healthcare system, go look at UofL Health's mission, vision, and values. Go look at ours. Go look at Baptist. Who aligns, right? Where do I want to be? Because if you don't have that, all the skill, all the competency in the world isn't going to get you through working in a place where there's a specific culture built around a mission, vision, and values.
And then I'll just echo that, except for I'll put one little caveat in. Go and check it out yourself.
Yeah.
Talk to other employees, talk network, Facebook, whatever, because what I've learned over the years is everybody puts good stuff on their website. And there are some really bad employers out there, and I'd actually wish if they would just say, hey, we suck, but we're gonna pay you more, okay, because that would help us all out. But go figure it out, because everybody has, the right mission statement, the right vision and values, but do they really live them out?
Yeah.
And you can use some of the online stuff, the Glassdoor, the, whatever, but even there, that can be gamed a little bit. So try to network around and find people working in those organizations and say, hey, are they really true to what they, put on the website or what they told you? And, when you go meet the people, observe them. Are they doing the things that are consistent with the values of the organization would be my good advice.
Yeah, and thank you. I think your values and the values of the company you work for are really important. And don't be a lunch tax. A lunch tax is somebody that nobody else wants to be around. Okay. So it's your NAS.
Exactly.
Yeah. So,
learning as we go.
Yeah.
It's your acronym.
So this has been great. We've got time though for questions. And I know there's some questions I didn't ask, and some of you probably want to ask, but if you have a question, please go up to the microphone, and we'll go from there.
One. There goes another one. Nice.
Thank you all for being, is this on?
It's on.
Okay. Thank you all for being here. I actually have a question, and I want to thank you for saying something about a drug, because it opened me up to have another subject. But I'll start this out with on election day, I worked in polls, and there were two people sitting at the table with me that by halfway through the day, we realized one of them had 33 years with Humana and the other had 37 years with Humana. So I must say, from that, it must be a very good place to work.
It's a great place to work.
My question is a concern that hospitals and insurance companies are starting not to work together. Humana had a situation, I guess, a year and a half ago where Baptist said, I'm sorry, we're not going to take Humana Medigap, or whatever it's called. Just recently, United Healthcare has come out with, I'm not going to supply certain services to people at UofL Health and with United Healthcare Medigap insurance. What's happening that we're not having our companies in our hospitals, insurance companies in our hospitals working together?
Yeah, that's a real challenge. I would say a lot of it relates to reimbursement.
Yeah.
And the cost of healthcare and just it's unaffordable right now. And so it's when we get in these situations of negotiating what that contract looks like, I think that's part of the challenge. We recognize that we need to have good quality, systems in our network, and so we continue to work with strong providers like Norton's and others and work through those challenges.
Yeah, I think that, I think the question came from over here. Generally speaking, though, those negotiations actually go really well, right?
Yep.
They work out, and you hear about the few where there is an incident. I think the reference was to Humana and Baptist at some point with Medicare Advantage. That is not the norm, right? Most times that those organizations actually figure out a way to get together, right? The healthcare organizations, such as mine, need to be paid for services. Humana's in the business of paying for services. That's why they exist, right? To ensure their members. And usually that goes really well. You do hear about the incidents where it doesn't happen, and that does happen.
But they need each other to survive.
Absolutely.
Yes.
And we both recognize that.
Absolutely.
Yeah.
Well,
Thanks for coming out today, guys. So it kind of got touched on with the Ozempic question, but a high majority of chronic illnesses in the country are caused by lifestyle issues, nutrition. Do you guys see the healthcare industry playing any role in ameliorating that, or are they just there to almost cover up the results? Thanks.
I don't think they're covering up the results. I think everybody knows we have issues relative to obesity, and that leads into chronic diseases and just lifestyle things. So, I guess this is more like maybe leaning on the insurance. When I worked at Humana, most of our membership was commercial, and you have a member for about 2.5 years. Then, and there was a small number of Medicare, which typically are for life. So there's some mechanics there related to, I think, how much money gets poured into maybe wellness early on, that it's over the top of, I think we have good preventable services that are paid for by insurance, but maybe there would be more if there wasn't this churn of members switching different health plans, so that invested dollar doesn't really yield a result for that health plan, it would yield a result for the health plan. And those decisions are often made by employers, not the person themselves, so it's convoluted. I think we'd all like to solve that, but it's kind of tough.
It's complex, but you're absolutely right. We spend way too much on treating symptoms and managing chronic conditions, and we need to move further upstream and spend more on preventative services. One thing we've been focused on, particularly with our Medicaid population, is social determinants of health. Yep. So those things that happen outside of the healthcare system that directly impacts a member's health. So do they have access to healthy foods? Do they have a secure place to live? And the list goes on. And so how do we spend more money on that? Recently, Medicare Advantage members, many of the insurance companies, we've been offering supplemental benefits. And a portion of that supplemental benefits can be spent on healthy food. Because if they have healthier food, then they're healthier themselves, less chronic conditions. But couldn't agree with you more. We've got to get further upstream, focus more on prevention and healthier lifestyles.
Yeah, and that's I think what I had said earlier, which is we really need to get out of the business of caring for illness and trying to prevent illness altogether.
Yep.
Social determinants of health is probably one of the biggest causes of a lot of the illness, and sadly, depending on where you live, it might determine how healthy you are or not how healthy you are. So I feel like if organizations like mine are trying to get ahead of that, a lot of times through partnerships, right? So who do we partner with to provide a small food bank in one of our hospitals, for instance, so that if someone comes in and they're undernourished or they're improperly nourished, can we get them access to some sort of a food source? You know, do we become, at least temporarily, a food source to address that kind of stuff? But that is the number one thing I think affecting health right now, especially when you're talking about long-term health conditions, right? Obesity and some other things that will have long-term effects on all kinds of ailments that folks will have to face.
You need to share your stat that you shared with us earlier about the life expectancy based on zip code.
So our CEO who's here today, thankfully, he's actually said this many times on camera, so you may have heard it. You know, if you live in some of the zip codes in our West End, your life expectancy is 15 years less than that someone who lives in a zip code, maybe let's say in the East End of town. That's not good. That's a real problem. And if we don't address that, and that's some of the things we're trying to do is address that, we will never get to the root of trying to prevent illness, right? We will have illness coming out of our ears. That's a really sad statistic. So let me say that one more time. If you live in certain parts of town, your life expectancy is 15 years less than if you live in other parts of town. That's bad.
Yes.
Question.
Thank you so much for this invaluable discussion. I'm really interested with all of this knowledge that have been transferred through you. But I would like to ask you some question regarding the pharmacy role. I'm a pharmacist, and I would like to know, like, AI is going to take over the role of the pharmacist in the future? And the second question, do you think like the pharmacist role are being critical in the healthcare, or it's been diminishing by the time? And the third thing, how like pharmacists should do or work on to overcome this challenge? Or do you think it's like shifting career in the future will be best, especially that pharma company now start to shift from being caring for people for just business? And what do you think about that? Thank you.
I'd like to grab part of that as an HR guy. My hope would be that AI, if that was part of your question, I think.
Was.
I would hope that would allow the pharmacist to sort of go off what Randy said a minute ago, a pharmacist again, right? So some of those things that are rudimentary, some of those things that are sort of processy, right, can be handled through an AI process, maybe some sort of mechanization. And allow the pharmacist, to be a practitioner, to really use that knowledge to consult with staff. You know, one of our really successful programs is this Meds to Beds program, right? So before you leave the hospital, we can get you your medicine from one of our retail, all of our hospitals have a retail pharmacy, right? We bring you your first, you know, your first 30-day supply, or whatever it happens to be, of that prescription, right? Those people, when they deliver those medicines, also spends a little bit of time explaining that. Now they're pharm techs, not always pharmacists, but the idea being the magic is is not so much that you take the pill, right? Be compliant with your medication, but the magic is in what is it doing? How is it going to interact with anything else I'm taking? Do you know everything else I'm taking? And allowing pharmacists to really be pharmacists again would be the magic in that.
Yeah, and I just want to underscore, I personally feel that the pharmacist is just the most important person in the whole care team. Like you all are my go-to person if I want information. You're just so knowledgeable about a breadth of thing and you have time to talk. But to your point, I think, well, you don't have time to talk with patients like maybe you used to. So I hope that AI will help solve some of those workflow and efficiency issues for you, because it's really frustrating. Like every time you go, I just found out 2 days ago when I went to pick up my medicine. I've been trying to get them all synced so they come at one time, but every time your refill ends, they go off sync again, and you have to as a patient has to know to go do that. That's such a burden for you all, because then you have a patient like me coming and say, can you sync those all up again? Can you go look at my... So hopefully it's going to help you, and don't get discouraged. We need more of you, not less.
Be positive.
I just think you all are awesome.
Thank you so much. And what about the pharma industry? The pharma industry, pharma companies. Do you think like they have the balance between like health caring for people, really care for people, or just for profits and business?
Pharma
Big
industry.
pharma.
Big pharma.
It's really hard. I don't know what all they struggle with, but I do know it takes millions and millions and millions of dollars to get a drug to market. So that's why they cost a lot when they first come out, but there's some stuff in there that probably could be improved.
Good answer, I like that. No, I think there is serious capital investment involved, so it's no different than what the sister told me, is there has to be a margin and a mission, and a lot of their investments come up with zeros. Okay, that are failed investments. And so it's as Jackie said, it's a very difficult question to answer on what they should be able to charge when they go to market. And immediately everybody sees another country's charging less or whatever, but there's more that goes into it than that. It's just very complex. And candidly, I think it does need some oversight. And I think actually CMS is now negotiating on behalf of Medicare recipients the price for the top 10 every year. And so I think you will see some government intervention there. More so, it's been difficult in the past. It's government, it's lobbying. We understand how all that stuff works, but you are seeing some progress made. And I think you will see, probably on the GL1s were mentioned, you'll see some progress made on that probably pretty quickly.
Thank you.
Question here. What was that on that side?
Hi. Sorry. My mom is a pharmacist, and she's been so for over 20 years. I vividly remember asking her, on a scale of 1 to 10, how much do you hate insurance companies? And she said 11. So my question for you is, why do you think that there's such a visceral hatred for insurance, especially healthcare insurance companies? And what could the healthcare industry do to help mitigate that or fix that?
Well, that was a loaded question, wasn't it? No, honestly, a good question. It's a lot of times with prescriptions, we do prior authorization. And so essentially we're reviewing the medical information for the member and saying, is that drug appropriate or not? So there is a bit of friction, I would say, between that insurer and the pharmacist or the physician or the hospital. And so one item we've been leaning into over the last several years is, how do we simplify that process? How do we leverage technology and automation and AI so that when that prescription is written, we've got all the medical information for the member, and hopefully in someday we won't even request an authorization because we already know that it's medically appropriate for that particular patient.
Yeah, I think it's prior auth, I think, can benefit a missionary. We have 2 startup companies that are here in the Kentucky region that are solving 2 different problems around that space. And one of the women started it during COVID, and she has raised multi-million dollars. The other one started a little bit earlier than that, and she's raised like 14, 15 million. So it's a problem, and I can understand why your mom.
And I would tell you my 42 years of experience on these kind of policies that kind of get put in place in companies, it's because of exceptions that happen, where people have abused the right to have a medication, for example. And you didn't used to have a pre-authorization. They trusted this physician that was writing the script that they wouldn't do anything wrong, or they wouldn't do anything in the best interest of the client, the patient that they're serving. And then when you have a problem, it's typical for businesses to normally react and put a policy in place, to put a procedure in place. Well, that only may have been a micro part of the problem, but now it's impacting everybody.
Especially with really expensive drugs.
Yes, really expensive drugs, or drugs that are scheduled, narcotics, those kind of things that have real implications to them. And so safeguards are put in place, and a lot of times those friction is a good, they do delay, and it's unfortunate, but again, I think,
and it's also to help control, unnecessary spend. The stat that I mentioned earlier, 25 to 30% of the spend that's in healthcare is unnecessary, doesn't generate any additional value. And so what are those safeguards to prevent some of that unnecessary care?
Yeah. So, okay. No question.
Thank you.
Thank you.
Oh, here we go.
Well, thank you so much for being here today. I really appreciate it. It's quite common knowledge and well known that among developed countries, the United States outspends other countries as a percentage of GDP on healthcare. For example, the United States spends around 17, 18% of GDP. I think the next country would developed country would spend 12, 11% on healthcare as a percentage of GDP. And healthcare expenditures is growth in healthcare expenditures is outpacing growth in GDP of the United States. So my question is, why is there a discrepancy between the United States and other countries in healthcare expenditure as a percentage of the GDP? And second of all, is it because are there any health outcomes that are positively correlated with that increased spending, and what can be done to minimize such a discrepancy between additional healthcare spending and health outcomes? Thank you.
Well, maybe it goes back to the question of the gentleman back there. We spend so much we have so many chronic diseases. How do we get further upstream? How do we focus more on prevention? How do we have healthier lifestyles? And I think that's part of one of many challenges, I would say, that exist.
I'm a math major, so I will use her analysis, and I can tell you that most of these other countries you're comparing it to are not as highly regulated as we are in terms of their healthcare systems and how they're doing it. Part of that is because many of those are government controlled, so they're self-regulated. Internally, we don't have that, and I think we're blessed as a country that we don't. I had a chance to operate in the UK, as Jackie did, and they actually have 2 health systems there. They have National Health System, which is their regulated, and they also have the private system because National Health could not meet the needs of the consumers and choices. So everybody always talks about having a single-payer national health system, and I think that's a little bit tricky. But if you do the math on your 12% versus 17%, and you take her 25 or 30% of wasted because we don't have interoperability, we have these excess frictions around pre-approvals and all those kind of things, I think there's a good bit that could be done GDP-wise to streamline, and I think we're going to have to. And I think that's where the innovations, that's where AI, that's where all these things need to come in. It's still, we can't talk to the Norton my chart in our business. And actually the Baptist chart is my chart. It can't talk to the Norton my chart. Makes no sense for a consumer. Now, again, there's protections and so forth around that, but that's all waste that's in the system. So I think it's a combination of everything, personal responsibility, lifestyle, and so forth. We are an independent, country. We don't want people telling us what to do, okay? Whereas some of those other countries have a little bit different culture around that and so forth. So it's very complex, but I think I'm optimistic. I think challenges create opportunities in life. And I think that's a great thing about healthcare is that, I'm not down on, and if you already look at value-based care, and we do, we're starting to save money. And we're starting to be more efficient, and that's only going to accelerate, and I think those are all good things, and I think each and every one of us, when I mentioned consumerism and taking control of your health, I think you should be taking control of your health. I think there is a personal responsibility we all owe to the system and to each other to be well, and so forth, and I probably didn't do the right things as a younger person to do that. Now as you get older, you want to take care of your remaining chassis here, and do the right things. But again, we all could start that early. Okay, and then that starts with a culture, maybe with your children, and so forth, how they grow up and assume responsibility. But it's a combination of everything. Great question, by the way, to ask.
I think one other thing that factors into is the health disparities I was talking about earlier, right? So we have some pretty great societal created health disparities in this country. And also remember, some of those equations never take into account that we tend to out-innovate a lot of those countries, and innovation costs.
Yeah.
People up here who are entrepreneurs can tell you
point.
what it costs to bring a new idea to market. There's money, there's dollars and cents that have to go into all that. So yes, we may spend more in this country, we also out-innovate almost all those other countries.
Good point.
And they take our innovations.
Right.
Yes.
Right.
Yeah.
Easy for them.
Everybody benefits from it, but
Right.
we do too.
Awesome, thank you.
You're welcome.
Question?
Hi, thank you for coming. So my question is, I know healthcare is already a complicated task itself to deal with, but how do you deal with deep-rooted systematic issues that affect certain groups more than others on top of ongoing general healthcare problems?
Can I jump in on that?
Absolutely.
Yes.
Address them head on, right? So you don't shy away from them, and you go to the places and the people who are underserved, and you make sure that they get the services they need. There's not a whole lot of ways to do that other than to take it head on. I'm sure we could get into a lot of specifics, but I think addressing, again, talking about the health disparities, talking about the societal things that have created those health disparities, if we don't look those things in the face, call them by name, and address them, we won't fix them.
Amen.
And we've got to put resources behind that.
Yeah.
Yes.
I mean,
Not just
You
talk.
have to spend the money.
I know it's not a commercial for us. I mean, one of the proudest
listen,
things.
I don't have a dog in the hunt. I'm a citizen of this fine community that we live in, and Norton Healthcare is to be applauded for the investment they're making in the West End. It was long overdue in this community, and they stepped up into a void and have executed. And that requires hundreds of millions of dollars of capital. But again, it was in alignment with a vision and a mission that they have for this community, and that's what's needed. And those kind of things happen, because the leadership of the organization makes the right decision consistent with its values. And so we applaud Norton, their board, their leadership for making that investment, and that will pay huge dividends to this community that you cannot even imagine what it's going to do to that area to have that as the anchor focus of improving the lives of those people that are living in those zip codes. And so again, I'm not interviewing for a job with Norton, but again,
You did well.
sounds like I am. Sounds like I am giving them a commercial, but again, that's not to go unnoticed, that investment in them stepping up. So thank you.
And we were proud to do it.
No, absolutely.
We were proud to do it.
All right, thank you all for coming out this evening. Earlier you mentioned that the industry, the population working in the industry is kind of aging. And firstly, I was curious if you saw that as a problem that you guys have in your industry. And secondly, do you see a way for educators to maybe support or provide resources for students who are maybe interested in entering the industry?
Absolutely. I think that's all of us up here that have been on the provider side understand that is an absolute must. That we have to expand knowledge of what the workforce can be. Okay, and he mentioned earlier they were in high schools. We started with high school apprenticeship programs at Trilogy, just to get people interested, let them know what the kind of jobs that were available. And they're not just jobs doing straight care as a clinician. I mean, you may want to be a chef. You can come be a 5-star chef in a healthcare system. They want to have the best things. You may, as he said, I think he was an accountant. I mean, all of these
All of it,
healthcare,
yeah.
you know, are out there, but there hasn't been kind of this knowledge base about what the career path can be. And by the way, all these organizations are not just saying it, they're putting money behind it. They'll pay you to go to college. They'll, you know, do all those kind of things to support those things. Similar, no dissimilar than what UPS, who's another great steward in this community, did with their metropolitan program and a number of people. They had a need for, you know, a workforce. They matched that up with education, knowing that a lot of those people that come through there may not ever work for UPS, okay? But it's a right community investment, and so they did a great partnership. So I think, you know, you've got to recognize it, and again, we've got to find ways to get that word out.
So think about, the first part of your question was, you know, what's going on? Yes, the population's aging, right? And if you look at the youngest generations, right, they are smaller in size than the populations that are aging. So it doesn't take a rocket scientist to sort of figure out that's problematic, right? We are now 60% millennial and Gen Z at Norton. We're 23,000 employees, and the vast majority are younger. If we don't have them, we don't have enough people to take care of the aging population. And that's generally who's a little more, who needs our services a little bit more. So this is sort of an upside down equation that we're fighting really hard to sort of fix. And to Randy's point, if we don't get in early and deal with the high school programs and get people interested, we won't have the people to take care of this aging population. There are more people in the older generations now than there are in the younger generations. And that's a problem.
But a great career path.
Great career path.
being selfish.
Anybody wants to be in healthcare, you've got a job.
Being selfish, we want you there, us
I
older
think-
people.
I think gentleman just made a great point. There will always be healthcare employment. That's the great thing
Yeah,
about life. I mean,
absolutely.
yes, the economy may go up and down, and if you're selling cars, you know, there's sometimes we're going to sell a lot of cars. Or sometimes you can't even get anybody to walk in the, you know, car dealership. Healthcare is always a need-driven business, and so there's always an expanding market, which is exciting in lots of ways. Yes, it brings challenges, but it also brings opportunities. So, you know, you may not be thinking about healthcare from the care side, but as far as being an entrepreneur, and I know we have a great entrepreneurial program here at UofL, I mean, it is always open because it's expanding, okay? And it needs innovation for all the reasons we talked about. So it's a career for life, absolutely.
All right, any others? All right, well, let's thank our panel for this wonderful presentation.